All right, welcome everyone to a new episode of the Roscoe's Wetsuit Neuro podcast. I am your host, Toby Pasman. If you guys have any questions, comments, or requests for any guests on the show, please go ahead and shoot me a DM at Roscoe's Wetsuit Neuro on Instagram. You can hit me up on Twitter at Wetsuit Podcast, or email me at roscoeswetsuitpodcast@gmail.com. I would love to hear from you guys. On the show today, we're going to have a show about ketamine, which was traditionally used as an anesthetic drug, but has since had some other applications regarding different sorts of pain disorders, along with mental health conditions, including depression and PTSD. And on the show with us today to speak about ketamine, we have Dr. David Mahjoubi. And Dr. Mahjoubi is a diplomat of the American Board of Anesthesiology. He earned his Doctor of Medicine at the Chicago Medical School and completed his residencies at the UCLA Ronald Reagan Medical Center and the USC LA County Medical Center. He is the recipient of numerous awards and honors throughout his academic years and has been recognized as a top doctor, best anesthesiologist by Los Angeles Magazine multiple years in a row. Dr. Mahjoubi carries over 15 years of experience with intravenous ketamine and is the author of multiple publications in the medical field. So Dr. Mahjoubi, super excited to have you on the show today.
Thank you for having me. It's a pleasure.
So you are an anesthesiologist. Tell me what was your first experience even hearing of ketamine or seeing it in clinical practice?
Right. So I was in residency in anesthesia at USC, or LA County Hospital. And I had this professor, Dr. Tanga, and he loved ketamine. And he was actually one of our best anesthesia professors at USC. And he just showed us various uses of it. We would use it in the ICU for people who needed to be sedated. We would use it post-operatively for people who, for example, had been using a lot of opiates and opiates wouldn't touch them for their post-operative pain relief. So we would start a drip of ketamine and that would work amazingly well. And then, of course, there's uses in general anesthesia, specifically pediatric anesthesia. Because ketamine is not a respiratory depressant, it has an amazing use for pediatrics, because we can sedate a child or even a 6-month-old without worrying too much about their breathing going down or their oxygen level going down in the blood. So that's when I first encountered ketamine, used it for 3 years in anesthesia residency. And then I joined Northridge Hospital, which is in the San Fernando Valley of Los Angeles. I was using it there. And then I have a couple of friends that are dentists and oral surgeons, and they asked me to help them with conscious sedation at their dental offices whenever I had time. So I would go there and do kind of a mini ketamine drip with some other medications. And a lot of these patients would text me or call me days after and tell me they felt amazing. And so I looked into this and found out that there's this whole field of psychedelics and anxiety and depression, and looked into it more and really just registered a domain. Was planning on doing it, maybe doing ketamine infusions for mood, maybe once every 2 weeks, and it just slowly grew since then for the past 7 years. So now I do this full time and do anesthesia 3 times a month, but have the clinic open 20 days a month.
So from my research and understanding of ketamine, it sounds like we don't know completely how it's working in the brain to relieve depression and some of these other conditions, although we do certainly know some things. Can you kind of explain how ketamine is producing these antidepressant effects?
Right. So we do know quite a bit, and every month new research is coming out. For pain, we've known for quite a while that it blocks the NMDA receptor, which is a pain receptor. So you block the receptor, you block the signaling of pain pathways, or the pain impulse going from, let's say, the point of origin, let's say it's in the hand, to the brain, being processed by the brain. For mood, it works on the glutamate pathway. And so by blocking the glutamate receptor, there's actually an activation of a protein signaling pathway in a neuron or a brain cell. And essentially what this does is creates neural pathways or new neural pathways and repairs old damaged ones. So pathways or connections between brain cells can be damaged by depression, by stress, lack of sleep, PTSD, post-traumatic stress disorder. And so what ketamine does is it repairs and strengthens connections between brain cells. That's the main mechanism that we know of. Another way it works is by changing the amount of electric impulses in certain areas of the brain responsible for anxiety and depression. So that's another way it works.
And tell me about kind of the process of what people are going through as they say someone comes in and is going to do a ketamine infusion. Can you kind of walk me through the process and the actual experience of the drug? I'm aware of kind of different effects at different dosages, but
right.
Kind of talk to me about what patients are generally experiencing.
Right. So most patients do experience a floaty, mild dissociative effect where they feel out of body. Many patients will tell me they felt like they were floating in space. For patients with post-traumatic stress disorder, such as childhood trauma, emotional abuse, physical abuse, they may relive that trauma, but in a very mild way. And of course, that's dose dependent. If one were to get an excessive dose of ketamine, they could relive the trauma in an intense way, and we don't want that. That's not necessarily more beneficial. So having done this for 7 years, I've arrived at a protocol that helps me understand what, for example, a patient with PTSD would need, or a patient with anxiety would need. With patients with anxiety, for example, you got to start a little lower because a little anxiety can be caused if the dose is too high. Getting back to your question, I do have some patients that only see shapes and colors, and that's okay. Many of those patients, if not most, still benefit from ketamine infusions. So everyone's really different, but the majority feel the floaty, space-like experience.
And how much, I mean, it may be a kind of chicken or the egg question, but how much of the sort of effects and improvements in a patient's, say, depressive symptoms are due to, say, the experience while they're on the medication, and kind of, as you're saying, sort of maybe re-experiencing, reprocessing some of that trauma, or is it just kind of the drug working alone, or is it a combination? Like what do we know as far as that goes?
Right. There's certainly no studies on that. I know there are a couple physicians at big ketamine clinics that believe it's entirely molecular and it has nothing to do with the experience. I would say slightly over greater than 50% of it is probably molecular. However, I do feel the experience is very important. And you can take a person with PTSD, for example. Reliving that and processing that trauma is really beneficial, of course, in a mild way, as I mentioned. So for PTSD patients, I think the experience is at least 50% of the beneficial mechanism. For patients with anxiety, the majority seems to be molecular, just because sometimes the experience can be a little anxiety provoking. But also there's a lot of patients with anxiety who feel a release of anxiety when they do a ketamine infusion at the appropriate dose. So the short answer to your question is, I would probably go with 60-40, 60% molecular, 40% experiential. Yeah.
It is like, I'm aware of, like, with certain psychedelics now, they're, working on like MDMA assisted psychotherapy, where you would actually like have a therapist in the room, guiding someone through an experience on that drug. Do you ever play around with that sort of thing with ketamine, and do you have an opinion as far as whether that could be helpful for a psychiatrist or some kind of other mental health professional to kind of facilitate some of these experiences as someone's under the influence of ketamine?
Absolutely. I think that's very beneficial. And there is definitely a movement recently called ketamine-assisted therapy, which deals with that. What I do at my clinic is I don't have a psychologist come in and see everybody who wants to do that, just because I feel a therapist or a psychiatrist is very personal. They should know your history. The first time you explain your history to a therapist or a psychiatrist shouldn't be under a ketamine infusion. It should be outside of ketamine infusion. So follow-ups would be beneficial. So what I do is I have patients FaceTime or do a Zoom meeting with their personal therapist or psychiatrist during the ketamine infusion. And we have private rooms for everybody, so it's easy to do. And many patients have said it's very beneficial. So yeah, but of course, you can also get a very deep therapy session with ketamine alone. So what I tell people is do both, do them alone and do a couple sessions with your therapist or psychiatrist.
Do people ever experience bad reactions from ketamine as far as like bad trips, in not in a medical sense of not, their body's not working right physiologically, but more in the sense of just psychologically bringing up material that might be difficult to handle? Or is that not too much of a problem with ketamine?
That does happen very rarely. Again, it's also dose dependent. I've had patients come from other clinics and they told me they had really, really bad trips on the first or second infusion. And when I'd ask them what their dose was, they tell me some really high number that I would never have started a patient out at. So the most common cause for that happening is getting too much of a dose. However, there are some people that it's just really hard to let go and have that out-of-body experience, specifically people who have a very strong need for control and just can't let go. And so those type of people can have issues with this. So for them, what I do is I'll add magnesium, which is a relaxant, to the infusion, or I'll add a tiny negligible amount of something called midazolam. It's an IV benzo, or let's say an IV Xanax. And, or I'll give that in the beginning of the infusion before they get any ketamine. And that really helps relax a patient and pretty much removes the possibility of a bad trip. But it does happen maybe a couple times a year,
Gotcha.
Yeah.
And as far as the frequency of these sessions that people need to kind of get relief from these different conditions, I believe in some of my research I was finding something that was like a 6-session protocol as kind of being the standard, and it was actually some really interesting research that was saying people often kind of felt actually a little bit worse after, I think, the second and third sessions before starting to feel better after some of the subsequent sessions. Are you familiar with any of that work?
I've never seen someone feel worse after the second or third. If they're a ketamine responder, then they progressively feel better with each infusion. Regarding the 6 infusion protocol that most clinics use, that's based on the original study that was done with ketamine, which was 6 infusions over 2 weeks. This is actually a very common question I get, and I always tell people, the reason why we do 6 is because of the original study, but it doesn't mean other schedules or numbers of infusions wouldn't work. So what I tell patients who come to my clinic is 5 to 6, but most patients do 5 actually, because we have great success with 5, over 2 to 3 weeks. Some people have a busy schedule and they just can't get 6 infusions in over 2 weeks. And honestly, 5 over 3 weeks, I've seen work amazingly well. I've had some patients that travel a lot for work and they did 5 over 2 months and they also really benefited. So if you're a ketamine responder, you'll benefit ultimately.
And do people usually experience pretty long-lasting changes after, say, 5 or 6 of those sessions, or do people need to come in for follow-up treatments?
Yeah, so I tell everyone that ketamine's not a permanent cure. It's just an amazing modality with minimal side effects, and definitely not the side effects one sees with common antidepressants, such as weight gain, impotence in men, or sometimes a feeling of numbness to the world and not being very emotional. Now, regarding the longevity of the benefits, again, that original study showed that it could last as little as 7 days only to as much as 6 months. I've seen people benefit for over a year. So what I tell people is it's going to last you 1 week to over a year, but there's no way to know until we try, unfortunately. One thing I do at my clinic to extend the benefits without people having to come to my clinic that often is I prescribe a ketamine spray for at-home use. And that has really helped a lot of people. A lot of my patients have called it a game changer because they'll use it as needed. If they're having a panic attack, 1 to 2 sprays in each nostril and boom, it zaps the panic attack. Whereas previously they were taking, for example, Xanax or Ativan. And yes, it would calm them down, but it also had that post-groggy effect. And they wouldn't be able to function, for example, at work or socially. With the ketamine spray, you certainly can function after 15 minutes. Certainly it's the re-exposure of the brain to ketamine multiple times that causes those molecular changes. But one does need intermittent boosters, and that could mean once a month, that could mean once a year, and everything in between.
I'm glad that you brought up the nasal spray. I was actually about to ask you about that. What are some of is it pretty similar as far as the experience or what the results are from using, say, the nasal spray compared to the infusions? Or can you kind of talk about the similarities and differences there?
Right. So, of course, with a nasal spray, you're going to have less bioavailability, which means the amount of medication that gets into your system versus how much is applied. So when I do or give IV ketamine, 100% of what I give goes into the patient. Whereas with a spray, you're going to have some loss to the atmosphere, some loss to the nasopharynx. So the estimate is around 40 to 50% bioavailability. So it's certainly not like the IV experience. We consider the IV infusion to be the gold standard when it comes to ketamine therapy. But it is a great microdosing modality to get in a little bit of ketamine every day if one wants, and kind of keep those molecular changes in the brain from regressing. And as I mentioned, helping with any anxiety because it does relax one. Now, regarding the experience, I always tell patients to not use more than 2 to 4 sprays at a time. Of course, if one unloaded 20 sprays at a time, they could probably get close to the IV experience, but I don't want that because they're not under doctor supervision. One can fall over, hit their head, or break a hip, etc. So while it is possible with the spray to get a intense dissociative experience, I don't advocate that without a doctor being around.
Got it. And as far as the dissociation, can we speak a little more about, I'm aware of kind of the effects being described as sort of like a detachment of sort of the brain from the rest of the body. And so how much of that is playing into the beneficial kind of therapeutic effects, and like why would you want to dissociate?
Dissociation seems to be correlated with a release of anxiety, is what patients have told me. Also, dissociating seems to significantly decrease rumination or negative rumination, at least for that hour during the infusion. But certainly ketamine is well known to decrease rumination overall on a day-to-day basis, and that's one of its benefits. As I mentioned, there's doctors out there who have ketamine clinics that don't believe the dissociation matters and that the efficacy is not correlated with a dissociative effect. In my practice, I've noticed that some patients do better or feel better afterwards if they dissociate. And if the reasons for that are unknown. It could just be correlated with that release of anxiety or that body relaxation. Given many of those patients are typically anxious and tense and have a lot of muscle spasms.
So they're probably getting some of that relaxation that they might not really ever be able to access in kind of their normal waking lives.
Right, absolutely.
So, when we kind of like look towards the future of ketamine usage, do you see, I mean, like say both with the infusions along with the nasal spray, I mean, with the nasal spray, are we going to see it being, as common as, say someone popping Prozac for their depression? Is it going to be taking a sniff of this nasal spray, or is it still going to be used just for select cases?
Right. That's probably going to be dependent on how many ketamine clinics and doctors are willing to prescribe it. Unfortunately, most ketamine clinics don't prescribe or offer the at-home ketamine spray. And that's for two reasons. One is liability. For example, if one were to use it, get in a car accident, that clinic may be held liable. And number two is, and it's sad to say, but many of these clinics want patients to keep coming back for booster infusions. So it's to their benefit to not prescribe the ketamine spray so patients return. I just really saw a need for this in many of my patients, and that's why I opted to prescribe it. So while I think over the next decade, the prescription of the ketamine spray will increase, it'll probably be a bit on the slow side.
How about just in terms of kind of the wellness or sort of peak performance market? Can ketamine play a role in that, as far as just kind of your everyday person who's wanting to feel more happy and less stressed out? Can ketamine infusions or the nasal spray play a role?
Absolutely. That's a great question. Even for people who are not depressed or have generalized anxiety disorder, it can certainly be a mind clarifier. It can boost performance. I've had a couple patients who have come in without depression or anxiety who wanted to try it for that purpose. And they told me they woke up the next morning feeling like they wanted to conquer the world and just were really able to focus on work much better than they previously had. So it definitely seems to have an amazing beneficial effect on neural pathways in the brain. Yeah.
Are there any areas or aspects of ketamine research that you feel like haven't really been tapped into yet, or that you're excited to kind of see what happens with going forward?
Yes, I mean, I definitely feel that many of the studies on ketamine could have more participants. That greatly amplifies the power of the study or statistical significance if there's more participants. Regarding specific parameters, there's a lot of schools of thought regarding ketamine infusions and what should or should not be added. I mentioned earlier that I add a tiny negligible amount of IV benzo to many of the infusions for relaxation purposes. There's many clinics out there that believe that inhibits the efficacy of ketamine infusions. Having done this for 7 years, I've especially the first 2 years, I would play around with adding it and not adding it, and I did not notice any change in efficacy. when that tiny amount of the benzo was added. So I'd love to see a study that includes that parameter and studies that effect. And also many clinics, including myself, we add magnesium. And there's a school of thought out there that magnesium actually amplifies the beneficial effects of ketamine. It certainly has a great place for anxiety. And I tell my patients with anxiety, if the ketamine spray is not sufficient, take a tablet of magnesium at home or at night if you're anxious and can't fall asleep. It definitely helps. And of course, different schedules. For example, how about 4 infusions over 3 weeks? Would that be beneficial? So that would be a great study to do. Getting back to another topic we discussed about 5 minutes ago, I did read a study a couple of days ago. It was actually a study that reviewed 6 studies, and it showed that out of 5 out of the 6 trials showed people had improved mental performance after ketamine infusions. And these people wanted to look at these 6 trials to see if there's any cognitive deficits from ketamine infusions, because certainly that's important to know. Are you going to have any memory loss with long-term ketamine administration or any other cognitive deficits? And this review showed that there weren't any.
That's super good information to know.
Yeah.
And one of the things you had mentioned before about kind of adding magnesium to the ketamine, that sort of makes sense. In my understanding, magnesium is also an NMDA antagonist, if I'm not mistaken.
Mm-hmm.
So that sort of synergistically might kind of block that receptor along with the ketamine.
Yeah, there you go. Yeah, absolutely.
In some of the other research I had seen on ketamine and kind of what it's doing in the brain, I had seen some stuff about delta waves, delta brain waves being kind of increased in magnitude during the course of this ketamine infusion. Are you familiar with that research?
Delta waves increasing in amplitude or magnitude?
Yeah.
I could see how that would happen. I'm not familiar with that research though, but yeah, I'll definitely take a look.
Okay. Is there any other research that we haven't talked about yet? I mean, it seems like you're very well read as far as the ketamine research. Anything else that we haven't touched on that you feel like is a really cool area of ketamine research?
Let's see. We talked about the cognitive deficits and there's obviously the benefits from a depression, anxiety, PTSD standpoint. Let's see. There was a clinical trial specifically addressing anxiety, and that showed a benefit. So that's definitely great. And there was one specifically addressing PTSD, and there was a benefit there. There was a study with adolescents, and that showed a benefit in the adolescent population. And I see patients over the age of 11, 12, and I've seen good results, about an 80% efficacy rate. I have a psychiatrist that actually sends me his patients with Tourette's, and it's worked great for Tourette's. And as you know, there's no cure for Tourette's and very limited treatments for Tourette's syndrome. So ketamine has certainly helped, and that's amazing. There's no specific study involving Tourette's patients, but this particular psychiatrist sees many patients and has noticed the benefit. And there's, of course, the pain syndrome, such as complex regional pain syndrome, otherwise known as reflex sympathetic dystrophy. And that's there's been studies on that show benefit. I've had a couple of patients come with swelling in their extremities from CRPS. And after one ketamine infusion, the swelling has gone down. It's really miraculous. There's no studies on that, but I've seen it firsthand multiple times. So it'd be great for there to be a study addressing that. Unfortunately, because ketamine has been around for 60 years and it's off patent, there isn't much of an incentive for big pharma to do massive clinical trials, because the return on their investment for the clinical trial won't be there. So that's the main hindrance to seeing a lot of other studies.
I see. Okay.
Yeah.
In terms of, if ketamine does kind of continue kind of exploding in popularity, I was reading a kind of just an opinion paper about just how, with the use of drugs like ketamine and psilocybin, MDMA, these psychedelics that seem to be so powerful in, treating depression, they were, kind of talking about, maybe this is kind of the treatment of depression. Maybe this can kind of, we can sort of eliminate, say, depression, anxiety, certain kind of mental health disorders that we've come to just view as sort of the norm, right? Especially with what's been going on with COVID, just illuminating just the mental health kind of crisis with what's going on. Do you kind of see that viewpoint, or do you feel like kind of in terms of just can ketamine result in sort of societal shifts in sort of mental health altogether?
Absolutely. I feel ketamine can, and psychedelics in general can. I'm not aware of psilocybin or MDMA causing some of the molecular changes ketamine does. That's why I think ketamine at this point is superior to the other psychedelics. But certainly there probably isn't enough research. I've had patients that have tried psilocybin and have benefited, but they seem to benefit more from ketamine. The one psychedelic that I've had patients try, but I wouldn't advise, is LSD or acid, just because if one gets too much, that can actually cause brain injury and permanent changes in memory and personality. So I wouldn't recommend LSD or acid, but I do believe psychedelics are the wave of the future, probably much to Big Pharma's chagrin, because a lot of these prescription antidepressants are big money makers for them. And I'm not saying there isn't a use for them, but certainly we need to rethink things if the incidence of depression and anxiety has been increasing over time in our society, despite having all these antidepressants in our arsenal. So, and I feel psychedelics, specifically ketamine, is the best way to rethink the approach and, arrive at a better modality for therapy.
Awesome. Well, Dr. Mahjoubi, we're coming up onto the end of the show. Any kind of last closing thoughts to wrap up our discussion on ketamine? Anything you'd like to leave the listeners with?
Right. Yeah. I just feel that if you've tried antidepressants, anti-anxiety medications out there, and either they're not working great for you or the side effects are intolerable, I really feel ketamine is the next step prior to TMS or ECT therapy. And my patient coordinator and I do free consultations, so you can always call the office and just ask any questions you want, and ask if you're a candidate for ketamine, which we'll assess complimentary. My website is ketaminehealing.com, and phone number is 866-987-7874. My patient coordinator, Alina, is amazing. She's super nice, and she'll answer all anyone's questions complimentary. And I've had patients come super skeptical, did not think it was going to work. And after 2 infusions, they're like, I'm in amazement. I can't believe how I feel. So it's definitely worth a try.
That is incredible. And I definitely recommend the listeners go ahead and check out Dr. Mahjoubi's clinic. If you guys enjoyed the show today, go ahead and like and subscribe to our YouTube channel, Roscoe's Wetsuit Neuro. And also go ahead and subscribe on whatever audio platform that you listen to the podcasts on, whether that be Spotify, Apple Podcasts, Stitcher, or any of the other major platforms. We are on them all. So Dr. Mahjoubi, I wanted to really thank you for coming on the show today and sharing all your expertise with ketamine with the listeners today.
Thank you so much for having me. It was so nice to meet you.